David, I'm now going to hand over to you to please share your story.
Well, thank you, Kelly. And it's been really nice listening to you. First of all, I would like to thank Egypt and Spain, of course, for inviting me to be here. And thank you, Kelly and RDI, for leading this, the request of this resolution. Well, my name is David Sánchez, and I live with an inherited retinal dystrophy. Maybe some of you have seen me and understood that I'm blind. Well, for me, it's a pleasure and a privilege being here in Geneva, speaking in front of all of you and giving my testimony about my condition. The condition I live with is genetic, is congenital, and degenerative. I'm here representing those adult people living with those conditions, because lots of times we speak about these conditions are related to children, to pediatrics, but children usually grow up and become adult people. And, I was diagnosed when I was 23, and the progression of my condition has led me to overcome lots of challenges and adaptations. And, I moved to low vision, something which is not really quite well understood. And finally, and eventually, I go blind. So during all my life, I had to face lots of barriers, and I have to fight against the society in order to make understood what's happening to me. So I think one of the most important things is, and it's something curious, because this side event, it's called From Invisible to Visible, and now a blind person is speaking here to you, and for me this topic is really nice. So I think there are a lot of challenges to face. I was listening carefully the two previous panels, and Dr. Becali from Alexion AstraZeneca said that patients have to make their conditions visible. But I think it is really important before this, because I live in Spain, I live in Europe, and I was clinical diagnosed, and after that I had my genetic testing in 2010. But there are a lot of places in the world, for example in Latin America, where a large amounts of money have to be paid in order to get a genetic diagnosis. And I think in order to diagnose a rare disease, we need a clinical diagnosis and a genetic diagnosis. And this is the first thing, and I think that as a patient, we have the right of having this genetic testing for free, covered by the national healthcare systems. Fortunately, in Spain, this is possible, but I think this World Health Assembly resolution and the subsequent global action plan maybe will help us to have this. Thank you.
Thank you very much, David. If there's one thing that you could say to people who are in a position to change policy now, what would it be?
Well, I can dream? Okay. Well, I think the World Health Assembly resolution, the subsequent action plan, maybe will mean there will be more equity in access to diagnosis, as well as access to future treatments. I think maybe the stakeholders and the country governments will develop policies in order to improve the quality of life of those 300 million living with a rare condition in this world. Here, and regarding this, I would like to thank the Spanish Ministry of Health. The minister, Monica, is here this evening with us, and their commitment with people with a rare disease in Spain, and the role they played to request the adoption of this resolution, and as well the work they are doing in Spain. Right now, we are currently updating these strategies she was talking to before. It was born in 2009. It was updated in 2014, and right now we are updating again it because we need to answer lots of challenges, new challenges that we have right now, that we have to face right now in Spain, and we are doing it all together, the government, professionals, and as well patients. And I think the collaborating way of doing things is the most important thing. And finally, I would ask and encourage countries not only to vote in favor of this resolution, as well, but also work together with patients throughout the world to effectively address these rare conditions. We need your help. I think it's the moment, and maybe we can dream, as I said before, and maybe it's the moment. So we are going to push. We are going to stay with you in order that this resolution, the action plan, and the implementation, as Alexandra said before, the implementation of this action plan will improve the quality of life of the people that right now is living in this world, because we are sharing this world all together, and have a better quality of life for those people.